Okay, we're going to talk about how to code case scenarios in the workbook. Let's turn to page 27 of the workbook and look at case scenario 1 in chapter 8. And the scenario reads, the patient fell off a bicycle, sustaining a bruise to her right elbow, an abrasion to her right leg, and she may have hit her head on the street. No LOC or loss of consciousness was reported. Because of suspected concussion, the patient was admitted for overnight observation. The concussion was ruled out and the patient was discharged. Final diagnosis, concussion ruled out. Now, coding case scenarios are not as difficult or intimidating as they first seem. Working through them, you will learn what bits of information you need to abstract correctly to correctly code each based on the official guidelines for coding and reporting. Now, every case will have at a minimum a principal diagnosis. Others will have an additional secondary diagnosis or multiple secondary diagnoses. Not every case documents a reportable principal procedure, while others may document a principal procedure along with secondary procedures. It's your job as a coder to abstract the information from the case using the OGCR to determine the code or codes necessary to accurately code the case so that proper reimbursement is received from the payor. Okay, first of all, we are not going to worry about assigning E-codes for the injuries to the patient at this point. Chapter 23 of your text goes into depth on how to assign these. Next, we will look at the injuries the patient did incur. First, bruise to the right elbow, abrasion to the right leg, an unspecified injury to the head with no LOC. Now, according to the OGCR for inpatient admissions, we want to review H, uncertain diagnosis, on page 103 of the text. Since the final diagnosis of concussion is stated as ruled out, we do not assign a code for this condition. However, you should assign codes for the 3 injuries incurred. The next step is to determine the principal diagnosis. Now you need to review number 6 of observation on page 191 of the text for selection of the principal diagnosis in this scenario. We will assign V71.4 observation and evaluation for suspected condition not found as the principal diagnosis because after the patient was admitted to the hospital and after study it was determined or ruled out that the patient did not suffer a concussion as a result of this accident. The secondary diagnoses in this scenario are the 3 minor injuries documented to the elbow, leg, and head, and should be listed in the order of severity from most extensive to least extensive as best as you can determine. Now, something you will learn in coding scenarios such as this one is that this V code must be used as the principal diagnosis in this scenario to prove medical necessity for the patient being admitted to the hospital, since you cannot code concussion ruled out. The hospital used resources to observe this patient and performed all evaluations ordered by the physician. So to receive reimbursement for these resources, the V code must be coded as the principal diagnosis. If only the 3 minor injuries are listed without the V74.1, the claim will be denied because they do not meet criteria for inpatient hospitalization or meet medical necessity for the resources used on this patient. Now, for example, if it was determined after study the patient did have a concussion, the concussion would be the principal diagnosis and V71.4 would not be coded because a concussion does meet criteria for medical necessity and the hospitalization for the patient. Codes for the 3 minor injuries would then be added as secondary diagnosis for this encounter. Now, not every patient encounter will include a reportable procedure that must be coded. Let's review the procedure codes that should be reported on page 125 of the text. Coders will, in general and according to facility policy, only code procedures that affect payment or reimbursement. The facility policy found on page 125 is a good general guide for learning which procedures to code. Quote, code all ICD-9-CM procedures that fall within 01.00 and 86.99 except insertion of Foley catheter 57.94. Do not code procedures that fall within the code range 87.01 to 99.99 except for those listed. Now, for the purposes of this course, students will follow this policy when coding procedures as to which procedures to code and which procedures not to code. Now, back to our scenario. There are no procedures documented that meet the definitions for a reportable procedure. So next you will enter your answers in the answer form in Canvas for this case scenario. Principal diagnosis is blank A. We will enter V71.4. Secondary diagnosis is blank B, where we will enter the 3 minor injury codes. Principal procedure is blank C, which we will enter none, and secondary procedures is blank D, which we will enter none. Now blank A is for the principal diagnosis. Only one diagnosis code is to be entered into this blank because there can only be one principal diagnosis. There are no exceptions to this rule ever. So for this case, you would type B74.1 in this blank for the principal diagnosis. Now blank B is for any secondary diagnosis or NOCs. You can list as many codes in this blank as necessary for all additional diagnoses documented in the case. However, not every case will have a secondary diagnosis. So for this case, you would type the codes for the 3 minor injuries sustained by the patient. 959.01, 923.11, 916.0, in this blank. Now continuing on with blank C is for the principal procedure. Only one procedure code is to be entered into this blank because there can only be one principal procedure. There are also no exceptions to this rule ever. So for this case, you would type the word none in this blank because there are no documented reportable procedures in this case. And finally, for blank D is for any secondary procedure or procedures. You can list as many codes in this blank as necessary for all additional procedures documented in the case. However, if there are none, type none in the blank. Now, points will be deducted from each case scenario for not following these instructions on entering codes into the answer blanks for case scenarios. You should recognize the difference between diagnosis and procedure codes and be able to determine from the documentation which codes are principal and which codes are secondary.